Welcome to the skin cancer capital of the world. New Zealand and Australia have very, very high rates of skin cancer. Skin cancer itself is uncontrolled growth of abnormal skin cells and is largely due to exposure to the sun, which of course New Zealand gets and Australia gets. Plus, we've mostly got fair skin, and fair skin is more likely to cause problems in terms of abnormal growth of these cells. The main ones we deal with are BCCs, or basal cell carcinomas, and SCCs, which are squamous cell carcinomas. Generally speaking, basal cell carcinomas are fairly safe, but they are known to sort of grow away, and if they're not removed, then they can cause quite significant defects. And you can sort of see that they have roots here, so when we do the surgery of this, we need to cut down through the skin and deeply into the fat to make sure that we remove all of the lesion. Squamous cell carcinomas are perhaps a little less common, but they do have a tendency and a possibility that they can spread elsewhere, so they can metastasize and cause problems with the lymph nodes and also spread elsewhere. The great majority of skin cancer surgery is done under local anaesthetic here at the office. I've worked through Southern Cross to do that as an affiliated provider, and we deal with a lot of patients in that way. Melanoma, of course, is very common in Australia and New Zealand as well, and of course that can have fatal consequences. Melanoma comes in many forms, and as a general rule, the thinner a melanoma is, the safer it is. But the thicker melanomas obviously need more working up. Sometimes we need to check for lymph nodes and also CT scans to check to see if the melanoma has spread anywhere, if it's a particularly thick one. A lot of people have moles, but what we're concerned about are moles that change. And the things that we look at in a lesion are its appearance. So if it has an asymmetry, or if the borders are irregular, or there are colour changes. If anything does look suspicious, I always think the safest thing is to remove it and check it under the microscope, and the microscope always tells us a more accurate story than what we can see with the naked eye.